Välkommen till ProHearings, Bioworks och CEO Mats Johansson. Här är din fjärrkontroll.
Mats Jonsson.
Jonsson, förlåt mig.
Thank you. I will tell you about Bioworks, who we are and where we are in our business build-up. So Bioworks, for those of you who have not seen me before, we work with chromatography and purification of biomolecules, mainly proteins, but also other biomolecules. We do that by using chromatography beads based on agarose. And agarose is especially good in purification of active biomolecules and keeping the biological activity of these biomolecules, which is very important, which also an annex I was into here earlier. The differentiation we have with our agarose beads are we summarize with faster, higher, stronger. And the key here is that compared to all other people in this business, we differentiate from the main player, and the main player is GE Life Sciences. So the agarose beads, they are 40 to 200 micron in our version. They are packed into columns. You put on a very crude sample on top and try to get out as purely as possible the target molecule at the bottom end. And we work down with improved capacity, improved production efficiency, and that is what we have summarized in the key point: faster, higher, stronger. Our beads are called work beads, and the latest big launch we had was at the end of last year, about a year ago actually. Work with Affimab, and that is for purification of monoclonal antibodies. And monoclonal antibodies is the fastest growing segment in this business and a very important segment from a value point of view. So it's very important to be in that segment, and now we are in all main segments for the use of agarose-based chromatography beads. You're probably quite aware of what's happening in the biopharmaceutical industry at the moment, and the growth of biosimilars. So it's a very high growth in this field at the moment, and they all need chromatography for purification, and they all need agarose-based beads for the purification of their products. We have today strong traction among small and mid-sized biotech companies, or to some extent also some CMOs and CDMOs. Very important in our business model is the long-term lock-in effect you have by that when you have built in a purification scheme into your production scheme, it's very difficult, or sometimes then for regulatory reasons, very almost impossible to exchange the product. So if you are a supplier going into phase 3, then you will be a supplier if they are successful all through the lifetime of that product, which could be then 15, 20, 25 years. So we are building up a stock of producers using our products, which will then, over a very, very long time, buy more and more product from us, depending on the success of their product. One of our customers have today an FDA-approved drug being produced using our media. And that's a very important step for us also in convincing the next customer to test and use our product. We have an important collaborator in Korea, Amikoyan. They also own about 10% of the company. They are in two ways a collaborator to us. They are our sole distributor in Korea and have good access to the market there, but they are also a collaborator when it comes to developing new products, in particular when we connect a protein like protein A to our beads. So they are the ones that have developed the protein A that we are using. So that's an important collaborator long term. Earlier this year, we became ISO certified. That's also an important step for us to be in the playing field to these producers of biomolecules. They, to different degree, all demand that they get their purification media from suppliers that are ISO certified. Actually, the bigger pharma companies even demand that to even start testing our product. So that was a very important step for us to start to get into the big pharma companies. And we have worked very hard the last couple of years to build up our active customer stock. We are after Q3 almost at 400. The goal for this year is 400, so it's quite likely that we will surpass that target for the year. You can see that into 2017 something happened, so we started to build the active customer base more rapidly. And that is very much connected to the focus that we changed at that time to be on life science and big pharma, biopharmaceutical companies to a larger extent. So the old focus that was quite heavy on food and beverage is gone. We have a couple of those customers left buying in larger amounts, but we have no focus sale-wise on that anymore. A little bit then on the Q3 report, we had a very nice growth for the quarter. And that is interesting because we had no sales to our biggest customers. The biggest customer last year bought well over 50% of our sales last year. But here you can compare and see what the other customers are buying. And we have done an increase on 147% for the quarter. That gives a signal what's happening with our other customers. It's to a large extent than the other customers that we have in production that are scaling up even further, and the ones that we have in late scale up that are buying more and more to get into production. So I think that's a very good sign what's happening with our other customers. Important as well is that we are starting to get traction in the United States. So there, if you take year to date, the sales in the US is 10 times higher this year compared to last year. And we are now at 1.4 million in sales so far this year, and there will be more this year. I'm quite certain about that. So I think we have done a good job getting into that market in a good way. What happened then early in the quarter was that we finished the directed and rights issue that we had. One of the new bigger owners, Peter Rehnheim, has come into the board and became the chairman. Peter is very interesting and important since he was up to 2011 the CEO or president for GE Life Sciences, the big player in this field, also situated in Uppsala. He knows this business extremely well, and he believes in us, and he can also then now give very detailed input on how we can maneuver in the field and grow more efficiently. It's a very good addition to the total team of the company. We also have done a good growth of active customers. We have a growth of customers in production. There are now 11. And it's important with this, maybe they don't buy so much early in production, but they are scaling. If they are successful with their products, they will be scaling up over many, many years. And here's also where we see the biggest growth in sales value is in the production group, and also to some extent in the group in late scale up. With our beads that are differentiated from all other agarose beads in the market, they are built a little bit differently, and they are extremely good working with, you could say, half-size proteins and smaller, and then also peptides, oligonucleotides, and fragments of antibodies. So here we have a sweet spot for our beads. Here's where we can, with good data, show that we have unique features and benefits. And here's also where we most often get into the customer and where they want to test our products. We also have another field regarding vaccines and the purification of vaccines based on viruses. So we have a well-growing niche there as well. So here is where we focus our sales effort very much in where we can differentiate. And these market segments are very healthy in size, and we believe that we can grow quite nicely within these areas. This is a very important picture for us. When it comes to our sales effort, we try to get into the discovery phase, at least in the late phase of discovery, possibly early scale up, get the customer to test our products, and then be part of supporting them using our products in the best way for their particular project. And then try to get as many of these projects using our product into then phase 3, and then in phase 3 we follow then the success of the customer. Here you see the growth of these different groups since the beginning of the year. Very important from that we get into the customer to when they can be in the early production phase. It takes 2 to 5 years usually. For some projects, of course, it can take longer time as well. So it takes a little bit of time to get in, to get the volumes. But when we are in the production phase, we will stay in the production phase for a very, very long time with, in many cases, growing volumes over time. And then we have very high stickiness in our business. Also interesting in the model is that if our customers want to scale up a factor 10, then the need for our product is also scaled a factor 10. So it's directly linear in the amount of our product that's needed to purify the customer's product. So with the success of our customers, we can grow for a long time depending on the growth of their product. So here are the main customer groups for us. As I said, small, mid-sized biotech we are well into. We have also very good traction in some diagnostic and specialty chemicals, biochemical companies. We also have some tractions in the CDMO, CMO group. Our biggest customer is in that group. We are starting to get into pharma and big pharma. They are, of course, have most projects and are important for us longer term, but they take longer time. They have more tedious procedures and are often using standard methods because they have many sites. So you have to get into the central testing organization. They test and then they spread the new methods over the whole organization. One example of a big pharma customer we have come into is Takeda. And they made a comparison with our products from Thermo Fisher, products from GE Life Sciences. And our product came out as clearly the best. From a chromatography technology point of view, the only product that gave really good chromatography results. So of course for them we are now a choice supplier for particular applications, the one that they have been testing in this case. Very important. Looking a little bit ahead, I think we now have good traction in North America. We are working mainly with the direct sales there. So we will start to build our organization during 2020. We will start Bioworks Inc. in the quarter 1. We will start to employ people, not that many. So we start with 1 and then we add another 1 over the year. So East and West Coast, we have come the furthest on the East Coast when it comes to prospects and customers. But we are also starting to get traction on the West Coast. But the most of the activity in this field is actually on the East Coast, in particular in the Boston area. In Europe, we continue to build the south in Europe. We are reasonably well covering the Northern Europe, including Eastern Europe. We are starting to get traction in Germany, and we will push that further the next year. And we will also start to heavily push into UK. Those are the two most important markets for us south in Europe. In Asia, we use completely a distribution strategy. In Korea, we build further using Amicoyen as a distributor. We will strengthen the technical support for our distributors in Asia during 2020. We recently exchanged our distributor in China to get more power, both in geography and in number of people on the ground. I think that is starting out extremely well. We will also add the distributors in India and in the Asian countries during next year. And as I said, we'll also increase presence of the technical support or application support in Asia going forward. I talked earlier about our Protein A product, so we can get into the monoclonal antibody market. We call our product Works ProHearings. We have some clearly differentiating positive data compared to the main player in the field. What we have found is that the data we have on HCD and HCP, which is host cell DNA and host cell proteins, where we are clearly standing out compared to everything else in the market. When the customers see this data, they get most often very eager to test our products. So we have a number of customers now testing the products. We have more than 70 samples out there, about 40% have tested. We have had 13 orders, and we have at least one company in a good scale up already in this particular field. How are we on time?
You can wrap up in like 50 seconds or so.
So summarizing then what we have achieved, we have launched the Works ProHearings. We have quite quickly come into the first scale-up project. We have the FDA-approved drug coming from one of our customers. We have increased our customer base last year with 100%. We may be close to 100% also this year. We had a record sale last year of 1.6 million. The US sale is rapidly growing, and we are now ISO certified. And going forward, we will very much focus well into 2020, also 2021, on building the sales, pushing that in the way I explained earlier. We are also working to some extent in R&D, but we are focusing more and more of the R&D resources towards the customer with application and technical support of the customer. So we see that we have built a good foundation for accelerated growth. We are filling our sales pipe faster and faster, and in particular, we are growing the number of customers in late scale-up and in production very well for future growth. And then, of course, aiming to get the lock-in effect I earlier explained. Faster, higher, stronger.
Thank you, Mats. Thank you, Bioworks. Very
Thank you.
exciting. Let's see if my simplistic brain is on the right track here. What's the short definition of a biological drug versus all other drugs?
A biological drug is usually then a bigger molecule that goes in different pathways and in some way then change the function of that pathway. The trick, at least for the proteins, which were the last speaker was into, the trick is to get it in the right place so you can actually do the right job. And then it means then for proteins that you quite often will have to inject it instead of having a pill.
Okay. So, and this is a specific group of drugs. So there are biological drugs and there are non-biological drugs.
Yes, so in a way, if you simplify it, old traditional drugs and then I can even say future drugs, because most of the new drugs today are actually biopharmaceuticals.
Oh, so already 2019, most of the new drugs that come out are biological drugs,
Yeah,
over 50%.
yeah.
But if you look at all the drugs available today for all
Well,
treatments in the world, how big
market,
part is?
the market is at about 20% of the total market, growing to towards 25 now are biological drugs. Yeah.
Okay. So this builds for a case where if we go to fast forward 20 years to 2040,
Yeah.
most drugs will be biological
I'm
drugs.
not certain about most, but the larger proportion will be, yeah.
Okay.
Sales figures are still very low. You're building an organization in the US that brings on additional costs.
Yes.
So my guess is that you will need to sell well over 50 million Swedish just to break even.
Yeah, that's
What-
our estimation as well, yeah.
Yeah. What is the average sale to a company that is in production?
Today,
Not today, but in the future.
okay. That will vary. It could be 300,000, 500,000 every year or every other year, or it could be 10 million every year. So there you have the whole spectrum there. So it's because they are different. They have different volumes when it comes to production biopharmaceuticals. If they're working with diagnostics, it may be quite low in the beginning and then growing over a longer period of time. So it's quite different. Hard to say.
You showed us your numbers, and they looked quite good. You have a big gain in number of customers. You also had a very nice Q3 versus Q3 2018. But something is a bit strange, because when I look at accumulated for 2019, Q1 to Q3 19 versus 18, you're actually down a bit. How can that be?
Yeah, that is because the biggest customer last year, everyone knows it's Polypeptide. They bought for about 60% of our sales last year. They have yet to order anything this year. We are not worried about the long term regarding Polypeptide as a customer. They are very pleased with our product. They're very pleased with the method. The signal is that they want to scale it up. Then it's hard for us to say when they need to do that. So maybe we get some sales this year. If not, we're going to get a lot of sales next year. That's our view. But that's part of our business. These production customers don't necessarily order every year. So it's really the sales this year is not that far away from the sales this year then. Sorry, this year sales is not that far from the sales last year, even though we have sold for more than 2 million at this point in time to Polypeptide. So you can see that we have a good growth among our other customers at the moment, and that will more and more be shown in our total sales figures. And Polypeptide definitely will come back. Our estimation is that it will scale up further, so there will be more sales eventually to them than we've had in the past as well.
And your business model, you kind of have to enter the market with projects when they're early, because they need to be tested together with you. You cannot enter on an existing volume drug. They're already with someone else.
Yeah, I mean, the stickiness works both ways.
Yes.
If we can get the stickiness, our competitors who have been in the market for some time, they do have the stickiness.
Yes.
So it works both ways.
Yeah. And you said 400 customers. It must be that it takes some manpower from Bioworks to engage with each customer?
Exactly. So we think now that we have, in a way, enough active customers. So we will not focus as much on building that in the future. We will focus more on the ones that we have in scale up to get them into production, and then also support the production customers when they need support, of course, to build the volumes as quickly as possible. So we will do that shift, you could say. And that's one reason that we're going to steer the technically skilled people in the organization more towards supporting the customers all the way into R&D, actually, going forward.
Someone in the audience wants the final question to Bioworks? Thank you.
Thank you.
Mats, thank you, Bioworks.
Thank you.